For most teenagers, in order for you to start seeing a therapist, you need your parents' permission. Hi, I'm Mallory Grimsby. I'm a teen therapist and I'm here to help you improve your mental health. I've got an awesome strategy called Dear Man to help you ask. So Dear Man is an awesome skill set to use when you want to ask for what you want and you want to be effective in getting people to give you what you're asking for. That could be having them respect your no, it could be asking to borrow a pencil, or in this case, it could be asking your parents to take you to see a therapist. So we're going to go through each of these different skills to help you get there. So the dear part of Dear Man is what you say, and the man part is how you say it. D stands for describing the situation. This is short and sweet. What is the current circumstance that's even making you want to ask for this? In this case, you're going to describe the situation that's causing you to want to seek therapy from the start. So if you're somebody who's been really struggling with anxiety to the point that it's impacting your sleep, you want to say, so I've been having a lot of trouble sleeping. If you are asking for therapy because you just feel angry and irritable all the time, you want to share, so I've been really struggling with my anger and irritability all the time. See how that works there? Just very factual, to the point, something that y'all can agree on. E stands for expressing your thoughts and opinions. This is not where you tell and shout at your parents that they need to do this for you. Please don't do that. That is not going to be useful or helpful here. But you can share what your thinking and interpretation of this experience is. This is an excellent time to use I statements and speak from an I perspective, which means that you're not telling other people what they think and feel about the situation. You're just sharing your own personal thoughts and opinions. So in this situation, you might say, I've been doing some research and I've noticed that therapy can help people who are struggling with this. You'll obviously want to personalize this to your style of speaking. You don't necessarily want to use my words because I'm not you. And you're not me. A stands for ask for it. So if you are wanting to see a therapist, you literally have to use the words and ask for it specifically. Don't leave it up to interpretation. Don't leave it up to your parents to guess what it is that you want or what you think would be useful or helpful, or they'll fill in the blanks the best way they can, and it might not match what you want. Again, clear is kind here. Be direct, be clear. Say exactly what it is that you're asking for. R stands for rewarding the other person. So a lot of times we come up with these big arguments and scenarios about what would convince us to give us what we want, but that's not really useful or helpful when you're talking to somebody else because they have their own experiences and their own way of thinking about things. So I want you to think about, from your parents' perspective, what would they get out of offering to bring you to see a teen therapist? And please, please, please don't say, well, a happier kid. All parents, for the most part, want that. There's lots of paths to a happier kid. Don't think about it from how it benefits you. Think about how it benefits them. All right, so now that you've got your list down of what it is that you want to say, you got to think about how you're going to say it to them. So that's where man comes in. M stands for staying mindful of yourself and others. So remember with the R one, we were talking about thinking about it from the parent's perspective, not your perspective. This is important here too. So you want to make sure that you are in a good, healthy, emotional state where you can hang in there and talk about this stuff in a gentle, respectful tone. If you can't do that, use your coping skills and come back. Also, making sure that just because it's a good time for you doesn't mean that it's a good time for the other person. So asking their permission, saying like, hey, is now a good time? I wanted to talk with you about something. You want to make sure that they have the time, care, and attention that this conversation deserves. Especially, I'm gonna go out on a limb here and guess that it's really important to you if you're taking the time to watch this video. So you want to make sure that it's important to them too. A stands for appearing confident. So I would highly recommend maybe practicing what it is that you want to say, or even going in there prepared, having it written down on a piece of paper, letting your parents know that you have thought through this and that you have planned ahead. It's going to help them take you more seriously. Now, of course, it's not always a guarantee, but it can help. And when you do talk to them, make sure to make eye contact. You don't want to just avoid. You want to speak up. You want to use your voice. Again, clear is kind here, and that applies to your tone and the way that you present yourself. N stands for negotiate. I don't necessarily mean about bartering and like sitting down at the conference table and like, okay, what are you going to give me sort of a thing. I mean, being willing to stay open to other considerations and possibilities. Maybe you want to see a specific therapist, but your parents don't agree with that style of therapy, but they're willing to take you to another therapist. Stay open to it and consider ahead of time what it is that you're willing to flex on and what you're not. If you guys are kind of stuck in a standstill where you really want to see a therapist and your parents aren't totally in agreement with that, you can also use the strategy of what we call turning the tables, which is literally to say to your parents, so I'm really wanting to see a therapist. You don't seem totally sold on the idea. What do you think that we should do about this? Now, of course, your parents can pull the ultimate parent card and say, well, nothing, I'm the parent. Totally a possibility. I can't control your parents. You can't control your parents. But you might be surprised that they might be willing to consider it in 2 weeks, or let's talk to your pediatrician first, or why don't we try this out first? Be gentle, hang in there, stay kind, and eventually your parents will either come around and understand that this can be beneficial, or you will become a certain age where you yourself can make these choices for yourself. Until then, if you are struggling with having your parents take you and your mental health seriously as a teenager, I highly recommend that you watch the video on your screen right over here. And if you found the information in this particular video useful and helpful, please share it. You never know who you could be helping. Thanks for watching.